A new study out this morning published in the BMJ Global Health Journal reveals that more than 14% of people worldwide have or have had Lyme disease, which you can get from ticks. Over the last 20 years, researchers found the numbers have been going up, and men over the age of 50 who live in rural areas are the most at risk. NBC News medical contributor Dr. Natalie Azar joins us with more. Always a worry, especially in summertime when you're out in the woods with kids. 14%, does that strike you as a big number?
It did strike us as a big number, absolutely. And I think, the way I would frame it is this. If you are unlucky enough to get bitten by a tick that's carrying the bacteria that causes Lyme, but you're fortunate enough to present with sort of very classic symptoms like a flu-like illness followed by that characteristic rash that looks like that bullseye rash, the diagnosis in that scenario is fairly easy to make, and antibiotics instituted early can definitely be quite effective. But as we were discussing before we started the segment, a lot of folks don't have that rash. Only about 3/4 of patients do. And if you don't treat early, you can develop these long, rather debilitating symptoms, joint symptoms.
Yeah, I was going to say, how do you know if you have it?
That's the problem. So early on, there is that characteristic rash that we always talk about. But after that, patients can present with, central nervous system fatigue, headache, and real actual neurologic deficits, as well as heart.
So how do you protect yourself if you're going out?
Exactly. So here's sort of the rule of thumb. Know what to expect before you even go outside. You want to definitely use repellent. So that is something like an EPA registered repellent, and also treat your clothing and your gear with permethrin. I think we have a thing for folks. You want to do long sleeves. You want to wear long pants. Tuck your pants into your socks. Avoid those wooded, high, grassy areas. Walk in the center of trails. When you come back in, shower right away. Shower, wash your clothes in high heat.
Really quickly before we let you get out of here, there's also some news this morning about a new drug that's been approved or about to be approved to treat alopecia. A lot of folks deal with this. Leads to hair loss. It's called Olumiant.
Olumiant, yeah. So this is really significant. About 300,000 people in this country have severe alopecia, and about a third of them would be candidates to be treated with this new drug. It's in a class of medications that's been around for actually quite a while, used to treat rheumatoid arthritis. And this one, Olumiant, actually is used to treat some patients with severe COVID-19. A word to our viewers out there, it is an immunosuppressive medicine, so your doctor definitely has to review things that you need to be monitored for and surveillance while on the medicine, but a huge boon for patients who suffer with this condition.
Olumiant.
Thank you, Dr. Azar.
Thanks.
Hey, thanks for watching our YouTube channel. Find your favorite recipes, celebrity interviews, uplifting stories, shop our favorite deals, and so much more with the Today app. Download it now.